Now we're joined in studio by Dr. Mina Murum. Thanks so much for joining us this morning. It's always fun to talk to you about all these different things that are happening in society. I want to talk today about ADHD. CDC says 6 million kids are diagnosed with ADHD. To start with, could you just explain what it is and how it actually differs from what just might be children lacking focus?
Yeah, absolutely. Thanks for having me again. Good morning. So the thing is, distractibility is not a disorder, right? Every day right now, there isn't a person who comes into my office who doesn't say, I could pay a little bit more attention or I could be a bit more focused. But in ADHD, we're seeing a persistent pattern that shows up in all areas of life, in work, in school, in relationships, and that actually becomes debilitating. This inability to stay on task, remember things, the impulsivity, but the key thing there is that a pervasive pattern that impacts your function, not just the one day where you have a hard time remembering a task, but really across the board.
Yeah, I could see that having a lasting impact. A 2023 Journal of American Medicine study found actually adult ADHD diagnoses that have increased by more than 120% over the last decade. That's incredible. Why are there so many of these cases in adults?
There are a couple of reasons for that. One is there's a lot more awareness now than there was several years ago, and part of that is a social contagion with social media, and part of it is just our understanding of ADHD has grown as well. But the downside of that potentially is that sometimes there could be a bit of an overdiagnosis. That's the balance we're trying to strike here of, are we diagnosing this correctly, or are we masking something that looks like ADHD? Because oftentimes, if I'm anxious, I can be distracted. If I'm down, I can be distracted. Several other things in mental health can actually produce a similar outcome to ADHD symptoms.
Now, why is there this perception now in the public that all children have ADHD? It's like, they're all in need of some kind of intervention, if you will.
There's a few reasons for that. One is, some of these symptoms are common in all children. At some point, a child will be distracted. At some point, a child will act out in class. That's normative behavior.
That's the text I just got from my wife, in fact.
Pay attention, focus, come on now. So because of that, we're seeing that to be an incredibly common overlap in children. And also, depending on what you see in your newsfeed. So our newsfeed is not necessarily always the most accurate thing. If I'm bombarded with several videos at a time that says, it seems like everybody around me has ADHD, why don't I? Should I look at my child? So that's part of it too, is understanding what a social sort of commonality among Instagram or TikTok versus what's really there in the prevalence of it.
And there are various symptoms that show up with this condition, in different demographics, right? Apparently differently for girls and women, but also in other areas. Could you lay out some of those?
Absolutely. If you think for a second about the noisy classroom when we were all growing up, right? If you think classically, who's the person that's going to get the most attention or is going to really have a teacher focus on them, is the most disruptive child. This is the person who makes the most noise, is the class clown, is making trouble. That's the classic sort of hyperactive presentation of ADHD, which we see more commonly in boys. But in girls, this often is the more inattentive presentation. This is the quiet, daydreaming, inability to focus or pay attention. So that's perceived as somebody who's just zoning out, as somebody who's just not really paying attention. So that's often the reason that it takes us 5 more years to diagnose ADHD in girls as it would in boys, because we just kind of label it as, they're just not paying attention.
A major difference generationally is, of course, there was no social media when we were kids. So is it the chicken or the egg? Is the social media creating more ADHD, or is that a response to social media? Now, which way do you interpret it?
There's a bit of both, because right now what I'm seeing, because of social media and several other factors, we have sort of an awareness recession or an attention recession.
Right.
It's hard for someone to pay attention for more than 60 seconds at a time. Yeah. But in addition to that, where all these other social factors, whether it's the food we're eating, in the diet, and how our lifestyles are, all of these things contribute to our inability in general to be paying better attention. So when you put those things together and you put the fact that, well, now you've got a community that reinforces what you feel on Instagram or on TikTok, that really heightens the experience for a person with ADHD.
Yeah, this does sound like it can present a lot of challenges for living and getting through life, but there must be some treatments out there, and also is there another way that someone can frame it or use their condition to turn it into a superpower in some way?
Most definitely. When we work with patients, we talk about the 4 S's. We talk about structure, both in school and at home. And what this looks like, this can be where a child sits at school, what kind of support they have there. And then for parenting, the kind of support they can have. What does it look like to develop a plan for your child? And then sustenance. Oftentimes when I evaluate a child's diet and I see, wow, look how much processed sugar there is in your diet and how that's impacting your inability to focus first thing in the morning. And then lastly is stamina, how much movement there is in your day. All of that goes a long way into combating this sort of rage into, well, just take a medication. And we know actually there's a DOJ investigation for some of these companies that we have to pay $3.6 million for forcing a structure to Americans about medications to essentially push these medications so much that it brought a shortage on these medications and pharmaceuticals.
Wow. Now, let's turn our attention now to symptoms, both for parents observing their children's behavior, which just could be naughtiness or some other environmental factor, versus an actual problem, and for adults, what are the symptoms that we should be looking out for?
Yeah, some of the symptoms we want to be really paying attention to, again, is the pattern piece. So oftentimes when I'm not engaged in an activity, I may not be paying attention to it. But the key there is if I'm seeing it across different areas, work, school, relationships, things like impulsivity. This is somebody who's blurting out, interrupting all the time. This is somebody who's having a difficult time staying on task. What you would look like, the picture here of a young child, this is a very chaotic backpack in a chaotic room. Difficulty with structure or remembering things, even things that they enjoy. Not just their homework, but even time with their friends. So when you put all these things together and you see, here are all the different areas that they're struggling with, and here's how this is a persistent pattern, the inattention, impulsivity, difficulty staying on task, these are some things that we really want to pay attention to.
And in our last 30 seconds, just want to get a sense of treatments.
Yeah, the treatment part, the 4 S's are really key for me because whenever we think about this is something that if you structure this well, this can be a superpower. I work with a lot of patients who are very high functioning, do really, really great work. And as long as I can frame this to give myself as much support as possible using those 4 S's, this can go a long way for me. This doesn't have to be something that defines me, doesn't have to be something that holds me back, but rather I can really use it to propel myself forward.
Psychiatrist Dr. Mina Murnam, as well as assistant professor at Columbia University, thank you so much for exploring this very important topic.
My pleasure. Thank you for having me.
Thank you.